Let me put on my clinician's hat first, because it is my culture, my story. I'm a heart surgeon. And when I hear about this fraud, I think about patients who have trusted us, people who are at their most vulnerable time looking for the protection of our services. And too often, these criminal entities have tried to pierce that trust. When you walk into the Health and Human Services building not far from here, there's a quote from Hubert Humphrey, from whom the building is named, and it says, "It is the moral obligation of government," that's what we're doing here today, it's the moral obligation of government to protect those who are at the dawn of their life, our children, those at the twilight of their life, our seniors, and those living in the shadows, folks who are having trouble, like the substance use disorder mentioned a second ago by Juliet. I want to applaud all of the agencies that collaborated today, because when President Trump signed the executive order on fraud, waste, and abuse, a pledge to crush this reality, this is exactly what he had in mind. At Health and Human Services, under leadership of Secretary Kennedy, we have strived to break down barriers and silos in every way possible. What you're witnessing on stage today is exactly that. The American government at its best, making sure all of us work together for the same common purpose, in this case, especially, expressly to protect those who are our most vulnerable. Because all great societies are judged by how they take care of those who are vulnerable, and we are great people. We will do that. So to the OIG, the DOJ, who's hosting us, the FBI, DEA, and other agencies that were engaged. And let me ask Kim stand in the back. Kim Grant runs, Chief Operating Officer and Deputy Administrator at CMS. She runs the fraud unit, and I'll speak about some of the work she and her team have been doing in my comments today. It is, and you'll hear this said by all of us, and we should, the largest Department of Justice health care fraud takedown in history. The fact that it's even possible that you could have $15 billion to play in this endeavor is shameful. But that's how we're being attacked now, and it's not done by small-time operators. As you're hearing about and you will read about, these are organized syndicates who are designing to hurt America. And why do they hurt our healthcare system? Well, CMS is probably the largest target of all, responsible for about $1.7 trillion of disbursements. So it's a big target on our side. And they can pierce the veil of protection by just getting identifier numbers from our seniors or Medicaid recipients or others, and thus use those tools, use you, the American people, to hurt us. What we're doing today is changing the paradigm. Not just going after bad guys and putting them behind bars, but actually getting ahead of these schemes so the money never leaves our bank account. Because by the time we find out that these criminals have stolen and the money has left the building, it's already offshore somewhere in some foreign country's vaults where foreign leaders are rejoicing in the fact they took advantage of the American people. That's why we use the word crushing fraud, waste, and abuse. Because this is not just a nice thing to do in an accounting pickup that we can, claw back money. It doesn't happen that easily. And this is a modern era. There are modern tools being used to attack us, and we need even more modern ways, including AI, which I'll speak about in a second, to take them down. The oversight has to be unrelenting. We can never let our guard down. While we're sitting in here right now, there's hundreds of thousands, probably millions of efforts being made to hack into CMS and our system, and we have systems designed to prevent that, to make sure the people who need us the most will find that we're there to protect them. The CMS Fraud War Room that I want to announce that Kim is going to lead is an effort as an example of this. It's prevented most of the fraudulent efforts to take money out of our agency. So most of the money never left the door, so most of the money was never stolen, even though we know you were trying to do it. And when I speak to you, when the president signed that executive order, he put a bunch of sheriffs, new sheriffs in town. And that's what you're looking at on stage today, and many others like us who are not going to tolerate this anymore. We're stopping stolen taxpayer money from leaving the door, stopping it in its tracks. Just when I was leaving the room today, the offices today, I was hearing about over $100 million that we've stopped from leaving the agency just in the past few weeks. There are 27 providers that are under active prepayment review, which means we're not going to pay their money until we verify that they're actually doing their jobs correctly. There's examples from telemed schemes in Florida with clinics billing for activities that they're not really, we don't believe, providing. There's a cardiology provider, and please help me understand this, who's providing cardiology services in person in Georgia and Nevada at the same time on the same day. Unless teleporting is being made feasible, not possible, but it happens. The audacity to think you could get away with this highlights the fact that folks believe they could have taken advantage of the agency in the past. We're going to make sure it doesn't happen again. There are mental health clinics, listen carefully, mental health clinics providing skin substitute placement on their patients. Again, you're dealing with ulcers in a mental health clinic. These services are provided by an anesthesiologist. Improbable. Money's not leaving the building. You're going to have to prove to me that there's a clinical benefit of a psychiatrist telling an anesthesiologist to put a surgical graft on a patient. It's not going to happen. We need your help. That's my big plea. We need your help, the American people. Why? Over half of the whistleblower tips that we get are for healthcare fraud, and over half of the fraud against our government is in healthcare. So we need your help, both to protect your own important information. Don't give it away because con artists come to your door and try to get it, but give us tips. You're going to hear all of us share opportunities that we have, but it only happens in healthcare because we know we have allies, the American people. We provide care to 68 million Medicare beneficiaries. 80 million Americans are on Medicaid or CHIP. There's another 20 million on the exchanges. There are a lot of people that will come to help us. So write this down, 1-800-HHS-TIPS. 1-800-HHS-TIPS. We have a URL, obviously, if you go to our website as well. And I'll leave you with one last thought. In addition to the massive fraud, especially from foreign entities trying to invade America using their financial tools and criminal mindsets, we also have 25% of all of our money being spent, probably subject to abuse. And that's not fraud. This is abuse and waste. Money not being used wisely. We just launched a new model called WISER with the Centers for Medicare and Medicaid Innovation under Abe Sutton that is looking at ways for us to identify inappropriate use of services that are wasteful and should not be offered to the American people because they could hurt them. And they're certainly not providing value for these wonderful Americans whose health is being taken advantage of to generate higher savings, higher revenue, rather, for providers. We're not going to tolerate it anymore. And we're going to use data analytics, real-time monitoring, and unhesitating and unwavering pursuit of the law to make sure this happens. I want to thank my colleagues on the stage and their agencies for all the wonderful work you have done. God bless you.